Heading to Abuja, we've got Dr. Akiala Ishaku, who is an epidemiologist, public health one at that. Good morning. Thank you for joining us today. Well, in taking some of the steps that we plan to take, there needs to be understanding, and perhaps understanding of this virus. So from what we know, your impression, first of all, on how we're proceeding with this one, because we're in this period now of this extended first phase of the easing of the lockdown. What do you think of it?
Yeah, Chamberlain. Good morning, Chamberlain. Thank you, Kayode and Ayo, for the platform. I want to say that going by what Dr. Obed Malafia have said, if I am to grade the national response in terms of performance, in a scale of 1 to 10, I will give it 0.5. This is because the Presidential Task Force has provided good leadership, although there are gray areas that we need to look into. And, but that brings to the national question, have we done enough in terms of robust testing? Have we also encouraged states to take ownership of this pandemic? What have we done in terms of cutting down the epidemiological transmission of this virus, human-to-human transmission? And so that brings to the national question, what we also need to also come up with plans, contingency plans to navigate around this. So as a public health expert, I want to agree with Dr. Obed Malafia that this has really exposed our weaknesses and has made us vulnerable. And we have so much neglected other tropical diseases that we are battling with. So my take here is that we need to have a unified policy, not to only focus on COVID-19, but to also look at other diseases, other infectious diseases that are threatening us as a nation, bringing to us a health emergency.
To be clear, when you say 0.5, do you mean 0.5 over 10 or 5 over 10?
Yeah, so I mean 5 over 10.
Oh, right. Okay, so over time, we've seen that, yes, we have extended this first phase, but apparently some policies are shape-shifting. Talk about precision lockdown, you know, trying to communicate this to people more to know that, okay, well, this is real. And that's a challenge, definitely. A lot of people still have this mentality that it is not real. We listened to this to the Lagos State government yesterday saying, well, apparently home care might be a thing. The Minister of Health also said a lot of people are choosing to stay at home. When you look at these, you know, little updates in our, well, maybe not little, but these, you know, shape-shifting in our policies, do you think they're enough to help us move away from this first phase into what they call the next phase?
Yeah, they are quite enough for us to move, to shift into the next phase. But it's not about the policy, but how about the implementation? I want to premise here that I am an advocate of what is called community court-martial. So if we can be able to adopt this as a policy, because we have done much about the top-bottom approach. We have not done the bottom-top approach. We have not yet engaged the community. Kayode, I have traveled to my village, and a lot of people told me that coronavirus is a disease of the urban settlement. You know, a lot of advocacy needs to be done at community level. And so I want to say that if we can be able to revitalize or strengthen our primary healthcare system and begin to come up with a cluster of community public health court-martial in communities, that will go a very long way, because these are people that will go into robust contact tracing. There are also people that are used to communities. They can be able to do a lot of contact tracing and begin to do a lot of case dictation and then begin to report, and then we begin to enhance our robust surveillance system. So I want to say that, yeah, the policy, if well implemented, can be able to take us into the next phase. But in doing that, we need to also come up with a lot of contingency plans and contingency measures that will also help these policies to be well implemented.
All right, we'll come back to this in just a moment, so please stay with us. All right, welcome back. So, Dr. Akiala, could you tell us, I mean, they've said time and again, we need to take responsibility, do as much as we can if we need to get this to work. Well, when you spoke up to members of your community and then they said, look, it's for the urban people, did you try to change their perspective on that as an expert, as a professional?
Absolutely. I have to go down to their level of understanding to be able to educate them about the existence of COVID-19. That brings to bear that we need to do a lot of robust community advocacy. Chamberlain, I have not seen the National Orientation Agency so loud in this outbreak response. So what is wrong with National Orientation Agency that we have them in all the states of the Federation? What I expected is from them is that to have a kind of a robust community engagement and then begin to translate most of these messages to our local dialect, more so that Nigeria, it is multi-ethnic in nature, and we are so diverse in terms of our ethnicity and religion. So what I expect is that the National Orientation Agency, through the Federal Ministry of Information, should be able to partner and then do a robust community advocacy.
Ask you this, Dr. Ishaku. We have heard suggestions from various people, various experts like yourself, say that because of the novelty of the nature of coronavirus, there is a lot we are still learning on the go. Does it suggest that the virus is mutating?
Absolutely. We need as a nation to actually strengthen our component of research. We have not done well in terms of research outlook. If you go to a lot of scientific websites to begin to see research or papers coming from Nigeria in terms of COVID-19, you will see that it is minimal compared to East African states, countries like Kenya, like a part of Uganda. So the virus is mutating. What we need to do as a country is to go into a robust genomic epidemiology to be able to establish whether the circulating strain of the virus is actually the same in terms of molecular relatedness to the one found in the US and in the Italy. So I expect by now those that came from China will get their samples and do sequencing. Those that came from the US that tested positive will also sequence the strain. Those that came from Italy, those that came from Spain, those that came from, high-risk countries. What I expected as a nation by now is that we would have first-hand information about their sequencing profile. And then we begin to come up with what we call phylogenetic tree analysis matching to check whether we have resistant strains that are mutating or they are changing in their genetic makeup. But still up to now, I am yet to say this, although I want to commend the Presidential Task Force for setting up the Technical Working Committee, which I know that they are looking into that. But, man, Chamberlain, this is 90 days already, close to 90 days into this outbreak response. So what we expected is that we would have gotten some epidemiological policy statements coming out that these are the circulating strains, these are the strains that have recombinated with the strains that are circulating in Nigeria. Our strains that are in Nigeria look similar to the one in the US or in Italy or in China. That will also bring to bear how we can be able to, go into diagnostics, how we can be able to see how we can be able to come up with a panel for testing. Nigeria is so endowed with human resources that it does not take a rocket science to do most of these things. But I think the component of research, we have not so much done well in terms of response. And how can we do well? Because this is a 21st century that is knowledge-based driven. You convert knowledge into products. By now, if we have the sequence of the circulating virus in Nigeria, we should be able to produce what are called primers, kits, for the testing of this virus. And then the cost of testing would have dropped significantly.
So a number of issues that you raised there, but just before we follow up on that, but hopefully don't lose your train of thought, you did speak about the NOA. Now, have a listen to this.
The lockdown was initially effective, but subsequently it waned in efficacy, especially in cities where enforcement measures were concentrated. However, in the suburban and the rural areas, businesses continued almost as usual, despite the lockdown. Many religious centers, or most religious centers, complied with the ban on gatherings, especially in the cities. But in the suburban and the rural areas, religious gatherings still continues as usual. Security operatives in some states are compromising the ban on interstate movement by accepting inducement and in exchange granting travelers easy passage.
So that was the NOA this week. How about that?
Yeah, so I agree with his position. Those are our predicaments, and those are the gaps that they have identified. But what are the plans that the NOA have come up with to be able to navigate this? And that brings to bear the model that we need to come up with, the Nigeria model, which I made mention about, the community court martial. Chamberlain, if you travel to your village and you begin to see community health workers involved in spreading the message together alongside with National Orientation Agency staffs in villages, that will go a long way. So we need to come up with not only National Orientation Agency staff, but we need to come up with a model to have what is called a community engagement, that we need to bring community, people within the community to be part of this fight. Communities need to have ownership of this response. And I think that's the gap we have seen over time. So what I expected is that we should be able to come up with contingency plans to begin to navigate around these challenges that we have. My take on this is that we need to come up with a community court martial. It is very necessary. We need to get volunteers from the community that can be able to pass this message down, that can be able to go into robust contact tracing and case dictation and begin to report appropriately so that we can be able to boost our surveillance system. From being passive to being active.
We try to follow up on that.
You can be able to.
We tried to follow up on some of those issues you raised and more, but the NOA says, look, well, he's issued a 5-page during his press briefing, and he thinks that is enough for now, but maybe much later he may be able to oblige us. That's talking about the NOA.
Yes, but there's this other issue that you just raised now, and that's the reasons, the things that the communities themselves need to engage in. Now, about this coronavirus disease, a number of people have also raised some issues. One is the fact that, look, malaria is a lot deadlier. We have more, serious challenges with Lassa fever and all of that. So, in fact, the Commissioner for Health in Lagos yesterday was saying, look, you don't shy away from telling anyone that you have malaria. Why would you be shy from telling anyone about COVID-19? So, question I'm trying to get to here is, if malaria is a lot deadlier than COVID-19, some would argue, why are we giving so much attention to COVID-19 and not so much attention to malaria that's been with us for so many years?
So that comes to my first remark, that we have so much devote our response to COVID-19 instead of having a unified outlook. Kayode Ayo Chamberlain, we are going to, I have supported states within the North Central region being mobilized by NCDC to support states within North Central region. in fact, we have neglected even people that need essential commodities, like HIV patients, like tuberculosis patients. We have also neglected even antenatal care patients. In fact, when you look at our outpatient visit, it has declined. So we need to have a holistic national outlook working document, a policy that can be able to have a wide range of approach and response to this, not only looking at COVID-19. Why is it that malaria kills more than COVID-19? It accounts for over 60% of outpatients visit and 30% mortality rate. And then we have not yet focused on that. We have not even yet focused on Lassa fever that is endemic and cyclic in nature and seasonal. So my take here is this, is that we must come up with a national working document of a Nigerian model that should be able to have a holistic approach and response to this. If not, in the next phase, we should be able to battle with health crisis. We should be able to battle with drug resistance, because a lot of HIV patients that I've interacted with said that their drugs are finished. They could not even get a refill of their drugs. I've known about 10 patients that are TB relapse cases that they have developed TB because their drugs got finished. So we must come up with a national plan to be able to navigate this, to have a national response that is unified in nature, that is robust. Chamberlain, what stops us in this point of lockdown that we can be able to even bring Nigerian postal services to, if we have a database of HIV and TB patients and even antenatal care patients, and then they can be able to, we can engage the Nigerian postal service to be able to deliver drugs, essential drugs, to TB patient, to HIV patient in their domain. What stops us from even having a robust strategic plan, a contingency plan to that regards? That even these NIPOs that are trained, even as we can even recruit people that are health workers to even take specimens from their home back to a center, and then we can begin to test and begin to look at their clinical outcome. So what it is expected of us in the next phase, it is novel, innovative, strategic thinking that we need to come up with a contingency plan to begin to navigate around this. If not, I think the next phase, we're going to be hit with a heavy health crisis.
Well, novel strategy for novel coronavirus, that's gotten brilliant. Well, but you also talked about the sequencing of the DNA. I recall that we published that just less than 2 weeks after the first case was discovered in the country. And, about the national approach also, you see what states are doing. But there's a national approach, but states seem to be doing what works best for them. So it brings a lot of question around whether or not this will be national and, just one approach enough. But on a final note, we could talk about this all day. But on a final note, do you see anything holding us back from navigating on to the next phase and opening up such that we don't record some of these issues which you have talked about? Is there anything that can hold us back?
Yeah, what is going to hold us back is that if we did not bring research components into this response, it is very key that we need to bring the research component into this. Ayo Kayode, do you know that the sequence that we publish is for just an index case, just the index case from Italy? How about people that came from the United States that tested positive? How about people that came from the United Kingdom and tested positive? The sequence of the virus might not be the same due to our climatic nature, so they should have undergone some certain level of mutation. What I expected from us as a country is that by now, NAFDAC would have given license to NIPRIT to start doing clinical trials of certain indigenous drugs or certain indigenous treatment regimens that we have as a country. So we need to look into this. If we do not support and push more in the aspect of research that are policy-driven, we cannot be able to make a headway in the next phase. So we need health economics to tell us how we are spending our money. We need public health mathematical modelers to tell us for how long will this virus remain with us? Because for now, you can hear that the United States are saying that we are going to open our summer camp in July. The Netherlands, where I did my PhD from, saying that no, they are going to open up their schools by September, October. What is going to happen to Nigeria? So have we engaged people that can be able to look at this and begin to model into the future and how our ease to lockdown will look like? Have we engaged people that are going to also come up with economic model? And that's what Dr. Obed Melafia is saying. So we need economic model to be able to push for this. Chamberlain, enough of copy and paste model from the United States of America, from the United Kingdom, and from part of Europe. We need the Nigerian model. What I expect to see is the Nigerian model. And for us to have the Nigerian model, it will be driven by research, because this is a 21st century that is a knowledge-based economy.
Well, we're going to hope that the PTF on COVID-19 may find time to respond to some of these issues, because even the question of the strain that is in Africa and Nigeria, there are questions about that as well. So we do appreciate your time this morning. And for those inside for Night Post, hoping the Night Post may find that useful eventually. That's a business idea, I tell you. Well, thank you for coming on this morning, Doctor. Yeah. So we will be back in a moment. Join us again.